Hey, it's Dr. Jarret. Welcome to Season 2, Episode 1 of 2 Cents Tuesdays with Dr. Jarret. Glad that you guys could join in. It's yet another Tuesday, and we have great things to talk about. Just as a review, last week we talked about allergies and getting your kids ready for allergies during the springtime. Lots of great discussion, reminded a lot of people about a few things. So it is that time. Of course, the further south you are, the more into the season you are actually already. Those of us on the mid-Atlantic and Northeast, we are still melting snow in a lot of places. So we're not quite there yet, but it's going to be there soon. As usual, pay attention to my feed. My feed is full of articles that I work with various journalists from various outlets that are out there. So I want you guys to continue to take a look at those. Lots of good baby tips, young tips, parenting tips. They're all out there for you to take a look at. So some of you guys just tuning in for the first time on 2 Cents Tuesdays are saying, well, who is this guy? Well, I'm Dr. Jarret. I'm your board certified pediatrician here to help those that need help with their kids, taking better health and better care of their kids through parenting. And I help them through my book, as well as other programs that I have forthcoming that are designed exactly for you. So all I'll ask you to do is share this video, because today's topic, asthma. A lot of people are affected by asthma, and it affects kids, adults, and various reasons. And asthma is one of the biggest topics that I get asked about time after time. So be sure to tune in and take some notes today, because we're going to have a big discussion about asthma. So a lot of people ask me, what is asthma and what does asthma do? Well, first of all, asthma is in the allergic category of diseases. So people often dissociate allergies and asthma, but in the reality of it all, they're in the same family. As a result, allergies, when they flare up, asthma can be flared up at the same time. So that's just one of those things that you need to keep in mind. And each kid is different. So asthma intrinsically is a inflammation of the lung tissue on the inside. And so you get the lung tissue on the inside of your body just kind of inflamed. It can lead to symptoms of things as simple as coughing, wheezing, or in more severe cases, difficulty breathing. So this ends up being one of those diseases that can be mild, it can be well controlled, or it can be life-threatening. So there's a wide spectrum, and if your child is affected by asthma, it's important you know which category they fall into. So there are acute or intermittent asthmatics, and there are chronic asthmatics. And so when you look at intermittent asthmatics, they tend to have more airways that are just very reactive. That means that the small airways, they may get very small at some times, cause some wheezing. This is particularly the case for kids that are affected by exercise-induced asthma. So those kids tend to run or have heavy exercise and may feel themselves breathing heavier than other kids in their age group, or maybe having extended coughing. They could also have some wheezing involved. Now, that doesn't mean that, if your kid is out of shape, they won't be heavily breathing too, but there is a variation, and usually the kid can sense that there is a little bit of chest tightness or something that goes along with that. So in an intermittent asthmatic, the symptoms aren't around all the time, and so they may only flare up during the time of a upper respiratory cold or exercise, are some of the two more common. And they may, if they need medication, they may only need it temporary, and that temporary medication is albuterol. And albuterol works by relaxing the airways, and then they feel like they're better. So those that have exercise-induced asthma or exercise-induced symptoms typically can treat themselves by taking the albuterol before their exercise, whether they're out playing hard or they're on a sports team, and that keeps everything in the chest relaxed and they're okay to go forward. There are other types of asthmatics though, and these are the ones that get most confused, because typically in asthmatics that are on the chronic side, so that means that their symptoms are always there. However, they're just there a little bit, but they may get worse time after time. And so it's important that you take a look at those types of things. Again, the symptoms can be the same. So it can be coughing, wheezing, tightness of breath, or difficulty breathing, depending on how severe it is. And you may need a medication to help manage that. A lot of kids try to keep their allergies under control, and keeping their allergies under control actually helps keep their asthma a little bit better. But again, in those chronic asthmatics, those airways that we talk about that are usually nice and wide open, they get really inflamed. So they get angry on the inside. And so that causes mucus, that causes just the air not being able to move through those airways in the right direction. As a result, well, difficulty breathing, wheezing, coughing. So what can you do about asthma? Well, location does have a lot to do with it. So if you live in the mid-Atlantic area or the eastern side of Pennsylvania, where I'm currently located now, it actually is always on probably the top 10 worst places for asthma. If you go out to a desert area like Phoenix, those areas tend to be better for asthma, and it's really just on what kind of pollutants are out there. There's lots of industrial pollutants on the East Coast, lots of trees up in the mountains out of the city areas. They have a lot of pollen, which can trigger, and between the pollution and the pollen, it can make asthma pretty bad for people. So it's something to take some notice of. In addition, there are some other things that go along with the treatment of asthma. So you have to think about how you treat the asthma. Oftentimes people go with babies or young children, they'll give a machine called a nebulizer to treat the asthma. And so it sprays a mist of medication that the baby can inhale. However, your typical inhalers, they are actually okay to use with young children, because inhalers should be used with a spacer device. And so a spacer device actually helps by getting the medication, instead of just coming out into the air or trying to breathe in that mist, which mostly gets in the mouth if you're taking it directly into your mouth. The asthma medication actually goes inside the chamber and it gets in the air. And so when you breathe into the mask from the child, the air and the medication goes deep into the lungs, where it is more effective. And so a lot of times this is simply done with albuterol, which is the medication that relaxes the muscles. Now back to chronic asthmatics, they tend to need a different type of medication, and their medication has some anti-inflammatory properties in it. And so those anti-inflammatory properties are exactly what the lungs need during that time. So it's important for them to take those medications every single day. And when they take those medications every single day, it keeps the inflammation down, it keeps the asthma symptoms down. As a result, they don't seem to have symptoms. Now, this is the key. A lot of parents often tell me, oh, well, they started this medication, now they're better, now I'm taking them off the medication. Well, when they come off the medication, that gives the chance for the inflammation to actually flare up again, and so then they end up with the symptoms again. They end up with symptoms that bother them or cause them some more difficulty breathing, the coughing, wheezing, or difficulty breathing. As a result, they need to get back on the medication. Typically, you're going to want to work with your doctor in just keeping them on a medication that they can take once or twice a day and help their symptoms. And then they stay pretty much symptom free except for the occasional flare up. And that's really the goal of therapy. You don't want to be using your albuterol inhaler every twice a day or a few times a day on a routine basis. You're actually going to want to take some time and get some of those the medications, the proper medication in order to work, which would be the anti-inflammatory medications. So, how you doing, Mariana? Thanks for joining in. Thanks for joining in, Paulette. 2 Cents Tuesdays with Dr. Jarret. We're talking about asthma today in light of allergy season, and as a result, we're talking about various ways that you can treat. So before we get into the final phase is what you need to know about these things are the spacer devices actually come in some different ways. They come with a mask with younger kids, and with older kids, it's a simple mouthpiece that you can put directly into the mouth and use with the inhaler. Just plug the inhaler in, get the medication going, have them take an exhale and a deep inhale. If they can hold their breath a few seconds, all the better. If they can't hold their breath, and they just take regular breaths, and that gets the medication in. And that's particularly effective with the mask form. So finally, we're talking about a lot of these inhalers, and inhalers also cause a lot of confusion because there are dozens of inhalers. And a lot of time people go to the doctor's office, for instance, and they say, oh, well, they're on the yellow inhaler, or they're on the red inhaler. And it's confusing for a physician because actually, well, is it this red inhaler or is it this red inhaler? There are a number of different colors that are on the market that cause some confusion. And so it's important to know at least the trade names or the generic names of the drugs, because that will help your physician understand the components within the medication and get that properly tailored, what we call asthma action plan, that will help them actually get better. So it's very important. And so most inhalers actually work best with the spacer devices, but there are a few like this one that actually are used only to be used with the mouth. So that causes even more confusion. So make sure when you get a prescription from your physician that you are actually understanding how to take the medicine, because some of these newer inhalers actually just click open. There's a powder inside of them, and then you just inhale the powder directly from your mouth, which is pretty much against everything else that's out there that goes with the spacer. So it's an incredibly important thing to think about when you're talking about treating. And that's why asthma tends to be so poorly controlled, because it's just confusing. And that's exactly why I wanted to bring you this topic, because again, you may notice your kids start to wheeze or cough or have difficulty breathing and seem like they may be having asthma symptoms. And as a result, it causes some additional problems with them. So it's one, as a parent, it's not uncommon to be confused. So don't be ashamed to ask questions so that you understand. Your doctor should be giving you a printed piece of paper that is called your asthma action plan. And that is the plan that you use for your child. And that way you can look at when your child is exhibiting no symptoms, what medicines to give, if any. When they're exhibiting mild symptoms, what medications to give. And if they're having severe symptoms, what medication should they have, or should they go right to the emergency room or call 911? So all of those things should be spelled out so you can hang it in a public place, put it on the refrigerator, give it to a school nurse, and they have all of that information right there. And then nobody's confused. They know exactly what it is, what the medication, and they know how to treat your child to get their symptoms reduced and get them breathing easier. And so it's a very confusing topic, because there's so many different options, there's so many different therapies, and there's so many different reasons that the kids can actually have asthma in the first place. Thanks for tuning in, Jamila, today. And you ask, how early of an age can a child be diagnosed with asthma? And typically, during infancy is a little bit harder time to actually diagnose asthma. Asthma in and of itself needs to have some time to develop. But in younger babies, they may tend to wheeze, they may get a particular respiratory virus called RSV, and the RSV can cause them to wheeze, and they may have something that we call reactive airway disease. And reactive airway disease is like a precursor to asthma. It doesn't mean that they'll go on to develop asthma, but they may be more likely to develop asthma at a later age. But typically by toddler age or by 2 years or so, we know if a kid is going to have asthma, and we would treat them as such. And although the treatment between reactive airway disease and asthma is not so different, we'll know if they actually have the symptoms of asthma as they go forward. So that being said, and that being the case, it's just another thing to take a look at. So thanks for asking that question. So again, as a parent, don't be worried about being confused on this topic, because it is confusing. There's a lot of different ways to treat, but it makes it worse too if different doctors are treating in different ways. So this is why the Academy of Pediatrics and a number of other places have just said, look, please write out an asthma action plan. So the asthma plan is there and ready for your kids. And if there are other things that you should be looking out for as far as symptoms, or maybe even other causes. We talked about allergens being pollen or mold, or actually some kids have asthma or reactive airway disease caused by severe gastric reflux. So lots of things to think about, and I wanted to give you that little bit of a topic as we're kicking off season 2 now, so that you know a little bit more about asthma and can have that discussion with your physician if you think you're having asthma symptoms or your child is having asthma symptoms. So thank you guys all for tuning in today and being interactive as always. I'm Dr. Jarret. I'm your board certified pediatrician, here to help parents take better health and better care and gain better behavior over their child. And I do this through my books and other programs I have forthcoming to you guys. So make sure that you share this video with some of your friends, especially if they have kids that are asthmatic, because you can never get enough education over asthma. And I will be back next week. Take care, and until then, you can find me on all social media at Dr. Jarret. Spell out the word doctor, J-A, 2 R's, E, 1 T. Guys, take care. Have a great week.